What if a medication your doctor prescribed to help you could actually be working against you in ways you've never been told? Not because it's dangerous for everyone, but because your body, at this stage of life, processes it completely differently than it did 20 years ago. Clonidine is one of those medications that's been around for decades. Originally approved in the 1970s for high blood pressure, it's now prescribed for everything from hot flashes to ADHD, from opioid withdrawal symptoms to sleep disturbances. It's inexpensive, widely available, and many doctors consider it relatively safe. But here's what most patients over 65 never hear. Clonidine behaves very differently in an aging body, and those differences can create serious, sometimes dangerous complications that catch both patients and their families completely off guard. This isn't about fear. It's about informed partnership with your healthcare team. Because according to the American Geriatric Society's Beers criteria, which identifies potentially inappropriate medications for older adults, Clonidine requires special caution in seniors due to significant risks that younger patients simply don't face. The National Institute on Aging reinforces this concern, noting that older adults metabolize medications more slowly, store them differently in body tissues, and experience amplified side effects that can cascade into life-altering health events. Today, we're going to walk through 6 critical warnings that every senior and their loved ones need to understand before starting Clonidine or if they're already taking it. These aren't theoretical concerns. They're evidence-based cautions from physicians, pharmacologists, and geriatric specialists who've seen what can happen when this medication isn't carefully managed in older patients. Warning 1. The blood pressure drop that doesn't warn you. Let's start with the most common and potentially dangerous effect: orthostatic hypotension. That's the medical term for what happens when your blood pressure drops suddenly as you stand up. You might know it as feeling dizzy or lightheaded when you get out of bed or rise from a chair. But with Clonidine, this isn't just an inconvenience. It's a genuine fall risk that sends thousands of seniors to emergency rooms every year. Here's why Clonidine makes this worse. The medication works by stimulating specific receptors in your brain that reduce the activity of your sympathetic nervous system, the part of your body responsible for the fight-or-flight response. When that system calms down, your blood vessels relax and your heart rate slows. That's exactly what you want if you have high blood pressure. But your sympathetic nervous system also helps your body adjust quickly when you change positions, tightening blood vessels in your legs and increasing your heart rate slightly to keep blood flowing to your brain when you stand. Research published in the Journal of the American Geriatric Society found that seniors taking Clonidine experience orthostatic hypotension at rates significantly higher than those on other blood pressure medications. The study tracked over 1,500 older adults and discovered that those on Clonidine were nearly twice as likely to experience problematic blood pressure drops compared to patients taking ACE inhibitors or calcium channel blockers. Now, why does this matter more as you age? 3 reasons. First, the baroreceptors in your blood vessels, the sensors that detect pressure changes and signal your body to compensate, become less sensitive with age. They don't respond as quickly. Second, many seniors take multiple medications and drugs like diuretics, which remove fluid from your body, or alpha blockers for prostate issues, can compound the blood pressure lowering effects of Clonidine. Third, and this is crucial, falls in older adults don't just mean bruises. According to the Centers for Disease Control and Prevention, 1 out of 5 falls causes a serious injury like a broken bone or head trauma. Hip fractures, in particular, can be life-changing events that lead to loss of independence, prolonged hospitalization, and significant increases in mortality risk within the first year. The warning here isn't to avoid Clonidine entirely. It's to recognize that if you're taking it, you need to move deliberately. Stand up slowly. Sit on the edge of the bed for a moment before standing. Use railings and assistive devices without embarrassment. And crucially, talk to your doctor about whether you need blood pressure monitoring at home. not just when sitting but when standing as well. Warning 2. The rebound crisis nobody expects. This is the warning that surprises people most, and it's the one that can be genuinely life-threatening. Rebound hypertension. If you stop taking Clonidine suddenly, or even if you miss a few doses, your blood pressure can spike dramatically, sometimes to dangerously high levels that can trigger stroke, heart attack, or hypertensive crisis. Let me explain the physiology. When you take Clonidine regularly, your body adapts. Your sympathetic nervous system is constantly suppressed, so over time, your body compensates by becoming more sensitive to stimulation. It's like turning up the volume on a system that's being muffled. When Clonidine is suddenly removed, that compensatory mechanism is still in place, but now there's nothing suppressing it. The result is a surge of sympathetic activity, a flood of adrenaline and related hormones that can send your blood pressure soaring far higher than it was before you ever started the medication. The medical literature describes this as one of Clonidine's most serious risks. A comprehensive review in the journal Hypertension documented cases where patients who abruptly discontinued Clonidine experienced blood pressure elevations exceeding 200/120, accompanied by severe headaches, anxiety, tremors, rapid heart rate, and in severe cases, encephalopathy, a dangerous swelling of the brain. The risk is highest in patients who were taking higher doses, typically above 0.3 milligrams per day, but it can occur at any dose if the medication is stopped abruptly. For seniors, this risk is compounded by something simple but significant: memory and routine disruptions. Maybe you run out of medication and can't get to the pharmacy right away. Maybe you're hospitalized for an unrelated issue and the hospital team doesn't realize you're on Clonidine because it wasn't listed on your medication reconciliation form. Maybe you experience side effects and decide on your own to stop taking it. Each of these scenarios, which happen more often than you might think, can trigger rebound hypertension. The American Heart Association emphasizes that Clonidine should never be discontinued without medical supervision. If your doctor decides it's time to stop, the medication must be tapered gradually, typically over a period of several days to weeks, allowing your body to readjust slowly. This is non-negotiable medical advice. If you're taking Clonidine, you need to treat it with the same seriousness you'd give any powerful medication. Keep it filled, take it consistently, and never adjust or stop it without explicit guidance from your healthcare provider. Warning 3. The cognitive fog that steals your sharpness. Memory lapses. Difficulty concentrating. That foggy feeling where thoughts don't come as quickly or clearly as they used to. Many seniors accept these as inevitable parts of aging, but what if they're actually side effects of medication? Clonidine acts on the central nervous system, and one of its known effects is sedation. For some patients, this is intentional. Clonidine is sometimes prescribed specifically to help with sleep. But the sedating effects don't always stay neatly confined to nighttime. Research from the Journal of Clinical Psychopharmacology found that Clonidine can impair cognitive performance, particularly in domains like attention, working memory, and processing speed. The effect is dose-dependent, meaning higher doses produce more pronounced cognitive slowing, but even standard therapeutic doses can affect mental clarity in sensitive individuals. Why are seniors more vulnerable? The blood-brain barrier, which regulates what substances can enter brain tissue, becomes more permeable with age. This means medications like Clonidine can have more pronounced central nervous system effects in older adults. Additionally, the brain's reserve capacity, its ability to compensate for minor impairments, naturally declines over time. So an effect that might be barely noticeable in a 40-year-old can be significantly more apparent in someone 70 or 80. The National Institute on Aging has raised concerns about medications with sedating properties in older adults, noting that they can contribute to what's called a medication-induced cognitive impairment that mimics or worsens dementia symptoms. This is particularly troubling because it can lead to misdiagnosis. A person experiencing cognitive dulling from clonidine might be evaluated for Alzheimer's disease or vascular dementia, when in reality, simply adjusting or discontinuing the medication could restore much of their mental clarity. There's also a safety dimension beyond cognition. Sedation increases fall risk, impairs driving ability, and can make it difficult to respond quickly in emergencies. If you're taking clonidine and you've noticed that you're feeling more mentally sluggish, that you're struggling to keep up with conversations or remember routine tasks, this is something to discuss seriously with your doctor. It may not be inevitable aging. It may be a medication side effect that has a solution. Warning 4. The heart rhythm disturbance hiding in plain sight. Your heart is an electrical organ. Every beat is triggered by carefully orchestrated electrical impulses that travel through specialized pathways. Clonidine can interfere with this system in ways that aren't always obvious until something goes wrong. The most concerning cardiac effect of clonidine in seniors is bradycardia, an abnormally slow heart rate, typically defined as fewer than 60 beats per minute. Clonidine slows the heart by reducing sympathetic nervous system activity and, in some cases, by affecting the heart's electrical conduction system directly. For many people, a heart rate in the 50s might be perfectly fine. Athletes often have resting heart rates in that range. But for seniors, especially those with pre-existing heart conditions or those taking other medications that also slow the heart, bradycardia can become problematic. A heart rate that's too slow means your body isn't getting enough oxygenated blood. Symptoms can include fatigue, weakness, dizziness, shortness of breath, and in severe cases, fainting or syncope. Research published in the American Journal of Cardiology documented cases of clonidine-associated bradycardia requiring hospitalization, particularly in patients who were also taking beta blockers, digoxin, or calcium channel blockers like diltiazem or verapamil, all medications that can independently slow heart rate. The danger is cumulative. Each medication on its own might be safe, but together, they can push your heart rate into a dangerous zone. This is called a drug-drug interaction, and it's one of the reasons why medication reviews are so critical for older adults who are often managing multiple conditions with multiple prescriptions. Beyond bradycardia, there's also concern about cardiac conduction abnormalities. Clonidine has been associated with atrioventricular block, a disruption in the electrical pathway between the upper and lower chambers of the heart. In severe cases, this can require a pacemaker. While this is relatively rare, the risk increases in individuals with pre-existing conduction system disease, something that becomes more common with age. The Beers criteria, which we mentioned earlier, specifically flags clonidine as a medication that requires careful monitoring in older adults due to cardiovascular risks. If you're taking clonidine, your doctor should be periodically checking your heart rate and rhythm, ideally with both pulse checks and electrocardiograms when appropriate. And you should be vigilant about reporting any new symptoms like unusual fatigue, lightheadedness, or feeling like your heart is beating irregularly or too slowly. Warning 5. The dry mouth that's more than just annoying. Dry mouth sounds trivial compared to blood pressure crises or heart rhythm problems, but in older adults, it's a side effect that can cascade into serious health issues. Clonidine commonly causes xerostomia, the medical term for dry mouth, by reducing saliva production. Up to 40% of patients taking clonidine report this symptom. Why does this matter? Saliva isn't just for comfort. It's your mouth's primary defense system. Saliva neutralizes acids produced by bacteria, washes away food particles, and contains enzymes that begin the process of digestion. It also has antimicrobial properties that help prevent infections. When saliva production drops, all of these protective functions are compromised. The consequences can be significant. According to the American Dental Association, chronic dry mouth increases the risk of dental cavities, gum disease, oral infections like thrush, and difficulty swallowing. For seniors who may already have compromised dental health, age-related changes in saliva production, or other medical conditions affecting oral health, Clonidine-induced dry mouth can accelerate dental decay and contribute to painful oral conditions that impact nutrition and quality of life. There's also a less obvious but important connection between dry mouth and medication adherence. Many medications are taken orally, and if swallowing is uncomfortable or difficult due to lack of saliva, patients may unconsciously skip doses or avoid taking medications altogether. This can lead to poor control of chronic conditions, missed therapeutic benefits, and in the case of Clonidine, the rebound hypertension risk we discussed earlier. The practical warning here is straightforward. If you're taking Clonidine and experiencing dry mouth, don't dismiss it. There are interventions that can help, including saliva substitutes, specific oral care products, and in some cases, medications like pilocarpine that stimulate saliva production. Your dentist and physician need to know you're dealing with this so they can help you protect your oral health and ensure it doesn't interfere with your overall medical care. Warning 6. The depression and mood changes that creep in quietly. Mental health and physical health are inseparable, especially in older adulthood. Clonidine affects brain chemistry in ways that can influence mood, and for some individuals, particularly those with a history of depression or those taking multiple medications that affect neurotransmitters, this can become a serious concern. Clonidine's action on the central nervous system doesn't just cause sedation. It can also affect the balance of neurotransmitters like norepinephrine and serotonin, chemicals that play crucial roles in regulating mood, motivation, and emotional stability. Clinical studies have documented cases of Clonidine-associated depression, characterized by persistent sadness, loss of interest in activities, changes in sleep and appetite, and in severe cases, thoughts of hopelessness or self-harm. The challenge is that these symptoms can develop gradually. They don't appear overnight. Instead, over weeks or months, a person might notice they're feeling less enthusiastic about things they used to enjoy, that they're withdrawing from social activities, or that they're feeling more irritable or emotionally flat. Family members might notice the change before the patient does. And because depression is unfortunately common in older adults, often related to life changes like loss of loved ones, reduced independence, or chronic illness, it can be easy to attribute these mood changes to circumstantial factors rather than recognizing them as potential medication side effects. Research from the Journal of Geriatric Psychiatry and Neurology emphasizes the importance of monitoring mood in seniors taking medications with central nervous system effects. The study found that older adults are particularly vulnerable to medication-induced mood disorders because they often have less robust neurotransmitter systems due to age-related neurological changes, and they're more likely to be taking multiple medications that can interact in complex ways. The ethical imperative here is clear. Your mental well-being is just as important as your physical health. If you or someone you care about is taking Clonidine and experiencing mood changes, this deserves immediate medical attention. Depression is treatable, and if it's medication-related, adjusting the regimen can often resolve the symptoms. No one should suffer in silence, and no one should accept depression as an inevitable part of aging or medical treatment. Clonidine can be an effective medication when used appropriately, with careful monitoring, and in the right patient. But the key phrase is, when used appropriately. For seniors, that means understanding that your body handles this medication differently than it did when you were younger. It means recognizing that the stakes are higher, the risks are more pronounced, and the need for vigilant medical partnership is non-negotiable. These 6 warnings aren't meant to frighten you away from necessary treatment. They're meant to arm you with the knowledge you need to advocate for yourself, to ask the right questions, and to ensure that you and your healthcare team are making decisions together based on the full picture of risks and benefits. If you're taking Clonidine, schedule a comprehensive medication review with your doctor or pharmacist. Bring a list of all your medications, including over-the-counter drugs and supplements. Ask specifically about drug interactions, monitoring protocols, and what symptoms should prompt immediate medical attention. Make sure your blood pressure is being checked both sitting and standing. Ensure your heart rate is being monitored. Discuss any cognitive changes, mood shifts, or physical symptoms that have emerged since starting the medication. And if you're being newly prescribed Clonidine, this is the moment to have an in-depth conversation about why this particular medication, what alternatives might exist, and what the monitoring plan will look like. Medicine is not one size fits all, especially in older adulthood. Your unique health history, your other medications, your lifestyle, and your personal health goals all matter in determining the right treatment approach. The American Geriatric Society reminds us that the goal of medical care in older adults isn't just to treat numbers on a chart. It's to optimize quality of life, maintain independence, and support the things that matter most to you. Sometimes that means using medications like Clonidine. Sometimes it means finding alternatives. But it always means making those decisions with eyes wide open, with clear communication, and with a commitment to ongoing vigilance. Your health is a partnership, and you are the most important member of that team. Stay informed, stay engaged, and never hesitate to speak up when something doesn't feel right. Because the most powerful tool in medicine isn't any drug or procedure. It's an informed, empowered patient who knows their body, trusts their instincts, and demands the care they deserve. This is Golden Years Health Stories, reminding you that knowledge isn't just power. It's protection, it's dignity, and it's the foundation of every good decision you'll ever make about your health.